Pleased to welcome in Lieutenant Governor Nunez. So, Lieutenant Governor, let's talk. I guess first, let's talk about COVID. We see today that we had the largest number of COVID-19 deaths in Florida, but we've seen a declining number of cases over this past week. People come up to me, there's so many numbers out there. How do you guys look at it from Tallahassee right now?
That is true. There are a lot of numbers out there. You could look at cases, you could look at death counts, you could look at the rate of positivity, and none of that should really underestimate the impact that this virus has had on individuals' everyday lives. That being said, though, it's important to recognize that yes. The number of cases have gone up, the number of deaths have gone up. But if you look at where we're at today, what are the things that we look at to make decisions in real time? Some of those things, of course, are the things that we've talked about: cases, fatalities, hospitalizations, the rate of positivity, but also the transmission rate, what they call the RT value. How prevalent is the transmission in a community? And so all of those things combined really paint the picture to allow us to identify what are the areas, what are the strategies, what are the resources, and everything from testing to PPE and all of those things that are really critical in terms of decision making. The least of which, obviously, we've been focusing a lot on hospital beds, ICU capacity, staffing. All of those things are complex pieces of this very difficult puzzle.
And do you feel, and I know having seen interviews that you've done in the past, I mean, everybody sort of acknowledges how serious this still is and that we can't let our guards down. Are we trending in the right direction, though? I know people are sort of looking for hope among skyrocketing numbers.
Yeah, you're absolutely correct. We can't let our guard down. And that's why it's important that individuals continue to do their part. Everybody has a role to play in this pandemic. But when you look at the numbers, again, from a statewide perspective, and you look at the county by county numbers, I would say that the trend is positive. The numbers are plateauing. The rates of positivity are declining. Over the last 4 days, they have been under 12%. In some counties, they are under 6%. For example, Alachua County has had good positivity rates for several weeks now. And so, again, the epicenter, if you will, is in South Florida. What we've seen, obviously, is a tremendous amount of testing taking place, on average more than 100,000 tests a day. That is obviously statewide, but those are important. Those are important metrics. We need to ensure that we're identifying the cases so that we can then implement the mitigating strategies. Again, South Florida has been under a mask ordinance. They have been under phase 1. We have never gone to phase 2 in South Florida. Other areas, obviously, doing better in terms of cases, rates of positivity, hospitalization, all of those things. But when you look at it in real time, again, it's important to have context when you're talking about an overwhelming number of data points and statistics.
And you led into my next question, in that we still here in Palm Beach County are still in phase 1. What would it take to get us out of that phase 1? I mean, it's been months, I know, since we've talked phases 1, 2, and 3. What does this county need to show before the state can perhaps relax some other things?
Sure, I think one of the most important things is obviously looking at the long trends, right? Those week-long trends that we look at in terms of positivity rate. Also looking at COVID-like illness presenting in the ED. So we monitor ED admissions, we monitor visits to the emergency rooms in order to see how many people are presenting with COVID-like symptoms. There's a lot of asymptomatic patients that are showing up at testing sites. Some for job requirements, some for curiosity, some for fear of being exposed. And so what we see is a lot of asymptomatic individuals. And what we also see is really a concerted effort to deal with the most vulnerable. We know this virus impacts the elderly much more so than those that are younger. We know that those in long-term care facilities, we've obviously put a lot of strategy and a lot of effort around those individuals. And again, we want to make sure that we keep every Floridian safe, but knowing what we know about this virus, and of course it's a novel virus, so we've had to learn a lot in a short period of time. The governor has really focused on protecting Floridians, especially those with the highest risk.
What do you say to people who are thinking about getting tests, even if they are asymptomatic? Should someone still try to find a test? Is it difficult with contact tracing at this point to help with that? I mean, what would you say to somebody?
Well, certainly if somebody feels that they have a reason to get a test, that's why the governor, as part of his 5 pillars, has really focused on the expansion of testing. We have walk-up sites, drive-through sites, mobile testing, self-swab sites. So there is no lack of testing available, but I think that people need to keep in mind not only their risk, their exposure, but really also understanding, you mentioned contact tracing. We have had an inordinate amount of testing going on. So what has happened is we've seen a little bit of a lag time, a delay in getting those testing results back. So as those testing results take longer due to the volume, what you see is the value of contact tracing. Obviously, the sooner you can get your results, the sooner you can implement those contact tracing investigations, and those will really lead to an understanding of where the individual contracted COVID-19 and help to mitigate other individuals. I think people really do need to do a good job of educating themselves. If you've been exposed, if you have symptoms, make sure you stay home, make sure you avoid crowds. If you're feeling ill, do not go out. And then those that have been exposed, obviously, the expectation is that you isolate. But there is a lot of overwhelming information for individuals that are trying to figure it out. And so our job as leaders in the state is to provide people with information and to provide them with resources and support.
Leading into the next thing about leadership and schools. I mean, that's the next big thing that everybody's talking about as we head into August. Do you see a situation, and it certainly seems that way in our media market? We have Palm Beach County in phase 1 and counties on the Treasure Coast in phase 2, and differing models of starting schools. How do you see that from Tallahassee? Is that a good thing that everybody has perhaps a different way of starting a school year?
Well, certainly, I think under ideal circumstances, we would love for our kids to go back to school and not have to worry about a global pandemic impacting their educational experience. I think everyone recognizes that the best place for a child is in the classroom. That being said, Governor DeSantis has obviously been working collaboratively, recognizing there are unique circumstances in some counties. He has insisted upon parental choice, giving parents the flexibility. I can tell you, as a mother of 3, for my youngest, the best and most optimal place for him to learn is absolutely in a classroom. And so we're confident we'll be able to get there, but we recognize some counties, as you mentioned, Palm Beach County, Broward, and Miami-Dade, may have to have different options, different models, and hopefully get to a place where parents will be able to send their kids back to school safely. I think that is the primary goal. We want to ensure the safety of our students, we want to ensure the safety of parents, and we also want to ensure the safety of our teachers.
And of course, the teachers, I think even today, the National Federation of Teachers is coming out sort of with safety strikes or something of that nature. Where do you see that? I mean, obviously, the teachers are perhaps some in a more vulnerable population age. Again, it doesn't seem like there are any best decisions, just better decisions, I guess, to be made here, right?
Yeah, and I think Governor DeSantis has said that. He recognizes that there may be teachers or others in the educational profession that have inherent risks, whether it's due to age or due to underlying conditions. And so we want to be mindful of that. We want to make sure, again, that teachers are safe. Schools weren't designed to be socially distant. Our children are not accustomed to having to wear masks and be 6 feet apart. So these are all new things that we're going to have to learn to contend with. But I really believe strongly that we cannot sacrifice the future of our children, their educational experience. We need to find a way to get together, work collaboratively with our educators, with all of the folks that are making decisions at the district level, and really find a way to, again, offer parents choice, because there are many parents that do not have the luxury to stay home with their child. They do not have the luxury to figure out childcare situations. So we really have a tremendous task ahead of us, but I feel strongly that as Floridians, we're resilient, we're innovative, we'll be able to find a way to insist upon the educational excellence that we have been accustomed to here in our great state, and find a way to protect and keep our children safe, as well as the teachers that are risking their lives in the front line.
And backtracking for a second, so did you say your youngest child will be able to start in a classroom? That's your preference as a parent?
That is my preference as a parent. We'll see what ends up happening. I think they're going to be making a decision here locally in the next couple of weeks. But that is to be determined. But I certainly would like to see him get back to a classroom.
And I guess lastly, with the decision to move the RNC out of Jacksonville, from a state perspective, you know, the state was going to sort of get the spotlight, and it's sort of taken away from the Tallahassee perspective. Is there disappointment with that? Is there a way to kind of keep that momentum?
Well, I don't think that necessarily disappointment is the right way to categorize it. Obviously, we would have loved the opportunity to showcase one of our great cities here in the state, but our priority is to keep our citizenry safe. And so at the point where the decision was made to change it, obviously things were a little bit different, what we've seen over the past couple of weeks with the increase in cases. And then from a security standpoint, the sheriff indicated that it was just very difficult to be able to pull it off from a security standpoint. So we respect the decision. We recognize why it was made. And I think we'll have ample opportunity to showcase what our great state has to offer on any number of fronts.
Great. Lieutenant Governor, did I miss anything else? Any other message from Tallahassee that you think is important for our citizenry to hear today?
No, I think you covered it all.
Right. Thank you so much for your time. I really appreciate it.